What does informed consent for Ritalin look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about Ritalin, which is a methylphenidate, or one of our types of stimulants. And so it's primarily used to treat ADHD. So the methylphenidates, as opposed to the amphetamines, are thought of as maybe a little bit less powerful because of their mechanism of action. So we actually usually start with an amphetamine-based stimulant for adults, but a methylphenidate-based stimulant for children. So Ritalin is a short-acting version of methylphenidate. Of course, there are longer-acting versions, things like Focalin XR, as well as Concerta. But with the short-acting version, it's probably going to last on the order of 4 to 6 hours. Stimulants are very effective for the treatment of ADHD, but there certainly are some side effects that it's important to be aware of. So side effects of stimulants are going to include things like elevations in heart rate and blood pressure because they are a stimulant, sometimes palpitations. If someone has a family history of sudden cardiac death or a significant personal cardiac history, or they develop palpitations, it's important to get that evaluated by a primary care doctor and or cardiologist with an EKG to make sure that there's nothing else going on. Additionally, there can be things like headache, agitation, anxiety, insomnia, decreased appetite, sometimes nausea, stomach upset, diarrhea. As far as adverse effects, in addition to those related to cardiac health, there's also those associated with mental health. There's a risk of increasing agitation, as I noted, as well as triggering mania in those who are vulnerable to bipolar disorder. When used in children, there also is the risk of stunting their growth. Additionally, this is a controlled substance, and that's because it does have high abuse potential. Most people taking prescribed doses are not getting high from them. However, if people are taking extra high doses, or they're combining them with other things, or they're snorting it, then those situations where the medication is being misused are what can lead to that high. This is not a recommendation. Please do not do these things. So it's important to keep in mind someone's history of substance use, their risk of abusing the medication, as well as the safety of them taking this medication. For example, if they are actively using other stimulants like cocaine or methamphetamine, then it may not be safe for them to be on a stimulant because of cardiac and other risks. The nice thing about stimulants is that you can really take them as needed. You don't need to take them every day. And so you can develop tolerance over time where you need a higher and higher dose to get the same therapeutic effect. And you can develop dependence, meaning that if you stop the medication, you may notice the opposite of the effects of the medication, right? So maybe feeling drowsy, having brain fog, feeling fatigued. But the withdrawal symptoms are nowhere near as potentially difficult or harmful or dangerous as those associated with benzodiazepines or even antidepressants. So most people can stop the stimulants, and after a couple of days of feeling a little crummy, they're fine. But I do recommend taking this medication just kind of when you need it. And that will help to mitigate things like growing tolerant, where you might get to a really, really high dose of stimulant and it's just not doing anything for you anymore. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for those of you who are interested in my content because they may have future courses or offerings or resources, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email and I'll see you in the next one.